Classification of skeleton. The skeleton is generally classified as exoskeleton, found on the surface of the body, and endoskeleton, found embedded in soft tissues within the body. The exoskeleton is characteristic of invertebrates. In higher vertebrates, it is represented by nails on the digits, horns, hoofs, etc., seen in some of the mammals. The endoskeleton, which forms a supporting framework, consists of two parts: axial skeleton, consisting of the skull, the vertebral column, ribs and sternum. Appendicular skeleton, consisting of the bones in the pectoral or forelimb and pelvic or hind limb. In addition to these arrangement of bones, small bones occur in the tissues of an organ or other structures, which do not form a part of the regular skeleton. These small bones are called heterotropic bones. These bones occur only in particular sites, in particular species of animals only. The typical examples are os cordis in the heart of cattle, os penis in the penis of the dog, also in bats, rodents and some primates, os rostri in the snout of pigs, os phrenic in the diaphragm in camels. Structure of bone. Chemically, bone contains both organic and inorganic matter, the organic matter being present in the bone are bone cells, collagen fibers and matrix or the intercellular substance. The organic matter chiefly consists of the fibrous protein, collagen, osine and chondroitin sulfate. The inorganic matter consists mostly of calcium phosphate, about 85%, and small amounts of calcium carbonate, 10%, magnesium phosphate, sodium carbonate and sodium chloride. The organic part contributes to the flexibility. The inorganic salts are responsible for the rigidity and hardness of bone. Microscopic structure. Bone is one of the varieties of connective tissue, consisting of bone cells or osteocytes, parallel rows of fine collagen fibers, which are embedded in the amorphous ground substance. The ground substance or matrix is impregnated with regularly arranged crystals of calcium salts. The deposition of the mineral matter renders the intercellular substance hard and impermeable, forming thin plates or lamellae. Macroscopic structure. The gross structure of the bone shows differences in the arrangement of these bony lamellae, forming either compact or cancellated bone. Compact bone is dense, white and hard and forms the outer shell of a bone. It is found aggregated in portions. Where there is greatest strain on the bone is exerted, it is arranged in the form of concentric system called the Haversian system or osteon. Cancellated or spongy bone is made up of delicate plates, which intercross each other forming a meshwork with spaces containing marrow. Cancellated bone is found in the epiphyses of long bones, and is always covered by a layer of compact bone. Haversian systems are absent. Long bones have an elongated cylindrical part, the shaft or diaphysis, and two expanded extremities or epiphyses. The shaft encloses the medullary cavity, which in life is occupied by yellow marrow. Inside the compact bone, there is a thin layer of spongy bone lining the medullary cavity. Each epiphysis consists of spongy bone covered by a thin layer of compact bone. The spaces in the cancellated bone of the epiphyses are occupied by red marrow. Examples for long bone are humerus, femur. Some long bones do not develop completely, and the medullary cavity is very small or even absent, which are called as aborted long bones. Example is ulna of horse. Some bones, though long, they do not have a medullary cavity, and are sometimes referred to as elongated bones. Example is ribs. Flat bones. They are expanded in two directions. They are plate-like, affording large surface area for the attachment of muscles and protection of subjacent structures. The flat bones are made up of varying thickness of spongy bone between two layers of compact bone. Examples are scapula. Flat bones of skull-like frontal, parietal. The flat bones of the cranial vault are composed of an outer layer of ordinary compact bone or lamina externa and an inner layer of very dense compact bone, lamina interna or tabula vidria, and between these is a variable amount of spongy bone called diplo. Short bones. They present similar dimensions in length, breadth and thickness. They are made up of a thin layer of compact bone outside, and spongy bone inside. The medullary cavity is absent. This arrangement helps to diffuse concussion. Examples are carpals, tarsals, sesamoid bones. They are short bones, which do not bear the weight of the body, and they are developed in the capsules of joints or in tendons. They alter the direction of tendons, and also give leverage to the tendons of muscles. Example is patella. Irregular bones. They are irregular in shape, and are usually placed on the median line. They resemble short bones in structure. Example is vertebrae. Some bones contain air spaces within the compact substance instead of spongy bone and marrow, and are therefore called pneumatic bones. These cavities are lined by a mucous membrane, and are termed as sinuses. They communicate indirectly with the external air. In mammals, some flat bones of the skull like frontal, maxilla, palatine, etc. enclose sinuses, and communicate directly or indirectly with nasal cavity. In the fowl, many of the bones are pneumatic. Examples are vertebrae, sternum, humerus and femur. These receive air through the medium of air sacs. Coverings of bones. The periosteum is a membrane, which invests the outer surface of the bone, except its articular areas, where it is covered by articular cartilage. The periosteum consists of an outer protective fibrous layer and an inner cellular osteogenic layer. Endosteum is a thin membrane lining the medullary cavity and larger haversian canals. Bone marrow. There are two kinds of marrow. Red and yellow. Red marrow occupies the interstices of spongy bone everywhere, and medullary cavity of long bones at birth. Red marrow is an important blood-forming substance, and contains precursors of erythrocytes, granular leukocytes of the blood, giant cells, which give rise to platelets and a few fat cells. After birth, the red marrow is gradually replaced by yellow marrow. In the adult, red marrow is present only in the vertebrae, sternum, ribs, skull bones and epiphyses of long bones. Yellow marrow consists of ordinary adipose tissue, especially in the medullary cavity of long bones and short bones. Yellow marrow fills the spaces of the spongy bone and short bones, carpals, and tarsals, and medullary cavity of long bones. Ossification is a process of development of bone from the mesenchyme. The flat bones of the skull are developed by ossification in a membranous layer, formed by the condensation of mesenchymal tissue. Hence, this process is being termed as intramembranous method of ossification. The bones developed by this method are termed as membranous bones. The bones of appendicular skeleton, vertebral column, ribs etc. are developed by intracartilaginous or enochondral method of ossification. In this method, a cartilage model of future bone is formed at first, and then it is replaced by bone. Bones developed by this method are termed as cartilaginous bones. Descriptive terms. Process. A general term for prominence. Tubercle. A small blunt projection which, if more developed, is called a tuberosity, while a trochanter is the largest of these. Spine. A pointed projection. Crest. A sharp ridge. Head. A rounded articular enlargement at the end of a bone. It may be joined to the shaft by the neck. Condyle. A somewhat cylindrical articular eminence, while an epicondyle is a non-articular projection in connection with it. Protuberance, prominence, eminence, torus. Varieties of bony projections. Trochlea, a pulley-like articular area. Glenoid cavity, a shallow cup-like articular depression, while a cotyloid cavity is at epo1, line a faint elongated elevation, whereas a crest is an elongated elevation. Facet, a flat articular surface. Foramen, a perforation for the transmission of vessels, nerves etc. Sinus, an air cavity within the bone, lined by mucous membrane, and communicates with the exterior. Hiatus is a depression leading to two or more foramina. The terms fossa, fovea and sulcus denote various forms of depressions. Cleft, a fissure in a bone. Laminar, thin plate of a bone. Cornu, a hamulus curved horn-like process. Canal, a bony tunnel. Foramen of some length. Meatus, a narrow passage.